Hello, everybody. I'm Dr. Reed Lerman, and this is Donna Zilber, a current patient of mine. And Donna came to me for some care, and we're going to talk about the care that she's had and why she came here, and how she's doing now. Okay? So, hi, Donna. How are you today?
Hi, Dr. Reed. How are you?
I'm great. So tell me, why is it that you first started care with me?
I was in constant pain morning, noon, and night, and I was living on pain medication. I have 2 small children and a husband, and I didn't want to feel like I was being drugged just to get through a day.
So when you say constant pain medication, what kind of pain medication were you taking, if you don't mind?
I started out on hydrocodone. I was up to taking 2 pills every 6 hours, which would be 750, so that was like 1,500 milligrams of hydrocodone, and I was getting used to it. So they had recently put me on a pain patch that contained opium, and that would be a 24-hour. It would actually stay on for 3 days, and then it would be changed. And I did not want to live in constant medication and not be able to function properly and not be addicted to the medication.
How long were you on the pain medication for?
I've been on the hydrocodone for at least 3 to 5 years, and the pain patch they had just recently put me on it, and at that point I was like, I can't go on with this, not with medication and living that way.
Wow. And what were your pain? Where was it at?
My pain was from top to bottom. Mostly, I had a very bad neck. I could only go about this much, and at a yield sign I would have to twist my whole back, and then it would cause me the back pain and the neck pain. My back hurt right across the back, sometimes pain down my legs, even the front of my legs. It was horrible. It was absolutely horrible. I also suffer from carpal tunnel. I have a lot of pain in the thumb. I have a lot of arthritis and spinal stenosis and all kinds of things going on with my spine. But this carpal tunnel, they actually told me I was at the point of surgery on both my hands, and I do not want to go through another operation. I know people who have carpal tunnel surgery, half and half. They either like it or didn't do anything. So I don't want to sit there and get cut open and have no use of my hands for a while to have it be worse than it is. And it was unbelievable. This pain, this thumb right here, caused me so much pain. If I was driving and the pain would hit, I would actually bite on my finger to make the bite feel worse than the pain inside. It was unbelievable. But I can say right now, I'm not feeling like that at all.
So were you pretty much in constant pain before?
Yes, I had a job where I was standing on my feet for 6 hours. I was fine while I was standing. When I went on lunch, I did not even have the option to sit, because the moment I sit down, everything would lock up on me, and then I would never be able to go back to work. I would stand on my feet for 6 hours. When I left my job and got in my car, I was like a cripple walking in my door. And then I spent the rest of my night in bed,
Wow.
literally in bed.
Now, are you still doing that same job?
No, I'm not doing that same job. I've left that job because of the problems I had, and now I do less on my feet, but I do have some bending, and but it's not as much as standing on my feet for that amount of time now.
So now, how are you feeling now that you've had my care?
I am off pain medication 100%. I don't need the patch. I don't need the hydrocodone. And most of the time, I say most of the time, I don't need even the muscle relaxer. Sometimes I have to take the muscle relaxer because I'll get like a twinge in a muscle area or something from something I did that day. But other than that, the pain in my spine, I feel like I'm nearly pain-free. My thumb barely hurts. The only thing I have is the numbness. It's a little still, but we're working on that, and I'm feeling a little better with that. I actually am not dropping as much. So there, I can say either, we're controlling it better.
And we didn't really start working on your wrist till like this week. I primarily was focusing on your spine.
It was unbelievable how quick everything happened.
Yeah.
In less than a month, I'm off the pain medicine. And I'm moving like I could turn my neck. I have like 100% better rotation in my neck, probably like a normal person now.
Now, when you were driving, would you notice that with turning your head?
Oh, I noticed that right away. I mean, I could only go this far, and then I had to go this way, and I still couldn't see. So when that yield sign, I was taking my chances, because I really did not have a clear view. But now, I can see all the way back there.
You can turn your head.
It's amazing. It's totally amazing, and I don't have to use my back to turn either. It's my whole neck. It's wonderful.
That is wonderful. Let's talk a little bit about the care that I've done for you, because it's not traditional care that people would seek normally from a chiropractor. And we're talking about the laser therapy. Tell everybody, I use a class 4 laser. It's called a K laser. It's a deep tissue laser. And it's very penetrating, and it reduces inflammation and stimulates tissue healing. So let's talk about your experience with the K laser and what the treatments were like for you.
The treatment was pain-free for treatment. All you did was put it on the areas that were affected, and it would feel a little warm, and it actually felt good. And I would have almost, when we started, I almost had immediate relief. It was like amazing, and you don't feel anything at all during the laser treatment except a little bit of warmth, and you go everywhere where I have the problems, and it's been completely amazing. It's like a miracle. Definitely like a miracle to me, because nothing would relieve my pain.
So they're gentle, they feel good, and the pain goes away pretty much immediately.
Yes, definitely.
Yeah. And then, how about as far as it lasted? Did you find each time the pain-free periods would last longer?
Oh, yeah, definitely. I barely had any pain in this thumb, and I would have it sometimes 2-3 times a day. And now I barely have any at all. My back, it's very minimal, if any. Some days it's like maybe minimal, but I have arthritis. So on rainy days I may feel still a little twinge here and there, but not pain. I wouldn't even call it pain.
Yeah.
It's amazing. Totally.
Excellent. So is there anything you, off the top of your head, that you'd want to share with anybody else who's considering care or suffering in pain about what we've done?
I would say put 100% trust in Dr. Reed, because he is an amazing man. The therapies that you did on me were a total miracle, and very, very quick. We've only been here for about a month or so, and I feel like a completely a different person.
Less than a month.
It is amazing, yes.
Excellent. Well, thank you. It's been a pleasure.
Welcome.
I'm glad you're doing better.
And I look forward to my visits, because I know I'm only getting even that much better.
Yeah.
Thank you. I really appreciate it.
My pleasure. Thank you.
Okay.
Why don't you just start with introducing yourself and tell everybody who you are.
My name is Joe Merlino. I'm a computer programmer / musician. Although I like to put musician first. But
and bluegrass, right? Tell us about your music a little bit.
Yeah, playing a bluegrass band. I play dobro, which is an acoustic slide guitar. And I sing, although some people question what I was really singing, but I can at least carry a tune. And, we're a pretty active band, get around, play quite a bit.
Good. The reason I put you in front of the camera today was to share your story about your back problems that you've had and how you found me and what things were like before and what they're like now. So I want to talk a little bit about your back pain first and what your life was like before I worked with you.
Yeah, actually, it's pretty present in my mind right now, because today's almost a year to the day that I started having issues. I had no idea what it was. I just, all of a sudden one day, was having trouble walking, and by the end of the week, I actually almost couldn't walk. So, to make a long story short, I went through, medical doctors and discovered that I had a herniated disc, which I was flabbergasted, because I had no idea how something like that would happen to me.
Right.
But I got to the point where really the pain was so bad I could probably stand up for maybe 2 minutes, hunched over, and after that 2 minutes I would have to sit down and recuperate for a while. So I really spent all last summer not being able to do anything except just to go anywhere where I could sit down and not move. Or if I had to go to the store, I would park out in the parking lot near the shopping carts, grab a cart and hang on to it, and I would walk a little bit that way. But as far as being able to walk on my own, I really couldn't go very far at all. I even was to the point where I was using a cane just to be able to, take some pressure off of it, or kind of like strategically plan to walk somewhere where there was a bench in between me and my destination so I could recuperate for a few minutes before I continued on. For example, like my stop at Wawa in the morning to get coffee was like a 2-stop trip. I would park as close as I could to the building,
That's terrible.
get out of the car, walk to the corner of the building, and I would have to stop and lean against the building for a few minutes, and then go ahead inside, make it to the coffee area where I could like lean a little bit and recuperate again. So it was quite an ordeal.
So you went through some adversity just for a cup
Just
of
to
coffee.
get Wawa coffee.
That's too funny. Now, so it affected your playing? Were you able to play? Or?
I'm such a hard nosed that I actually made all our playing jobs except I just went there with my instrument and a stool, had somebody bring those up on stage for me. I would sit on the stool, they would hand me my instrument, and I would play and just go back home when I was done playing.
What were you doing for treatment at that time to manage your pain? Anything?
I was in the process of trying to find out what I should do. The alternatives that I was offered was I had a series of epidural injections, some what they call facet injections, none of which was doing any.
Did you have them?
I had them done, yeah.
And then they gave you no relief at all?
No,
Okay.
no, minimal. I mean, it was probably just more in my mind thinking that. So I really had no relief from that. And then after that series of procedures, the orthopedist left me with surgery. But when he told me surgery, I was like, I must have turned white as a ghost because I couldn't believe that that was the alternative he gave me. And I was, as much pain as I was in, I still, for some reason, didn't want to accept that as an option. Number one, because I was scared to have it done. I was just afraid of it.
Right.
And, I've heard so many horror stories of people having back surgeries, never turned out right. So I was really holding out. I wasn't sure what I was holding out for, but I just didn't like that option. And this was after, I was probably 3 months of spending like the nights, I would sleep maybe 2 hours a night. The rest of the time was spent, sitting up on the couch, trying to, ease the cramping and pain radiating down my leg and my hip. So at that point, you would think that a person would resort to anything but even at that, I was still so uneasy about having the surgery done that I thought there must be some, a different approach.
How did you find me?
I started doing internet searches about alternative treatments for herniated disc, and I found your website and read in detail the explanation of the procedure, and there was nothing about it that didn't seem right. I mean, it all seemed to make so much sense that I decided to opt for that treatment.
And now, when you first came in, I remember I couldn't even get you to lay down.
I could not even get straight enough to lay flat on the table. That's how bad
I couldn't even give you a full exam. You were so bad off. And do you remember what those first 3 or 6? I think we did either 3 to 6 treatments before we even tried to get you to DRS.
Just laser.
Just laser. Can you describe what they were like for you and what you experienced?
Well, it eased up the pain quite a bit to where little by little I was able to straighten up a little bit more.
And that was with just the laser.
Yeah. I mean, I still was having trouble walking, but I could tell that just that treatment alone and I was determined to, no matter what, I wanted to get on that table to have the treatment. So, I just kept getting myself to straighten up more and more until I could finally, get and lay flat.
Yeah. And then we got you on the decompression. And what did it feel like when you first started doing the decompression treatments?
Actually, the very first time I didn't really notice much of anything. I mean, there's absolutely no pain or anything, any discomfort involved in the treatment itself. But I really didn't notice any improvement on the very first one, although I could definitely feel that it was pulling, that it was doing something. But after the second treatment, I remember, going home and standing there and just being able to move like that and thinking, wow. I was totally amazed. I told my wife, I said, look at this. A week ago, I couldn't even bend sideways probably more than a half a degree off center without having pain. And then all of a sudden, I was starting to be able to have mobility. And then it just started coming back little by little, in a natural way.
Right.
Probably as naturally as it occurred
Right.
is how it was coming
So-
back to me.
And now I don't recall. Did we have any setbacks through the main course of your treatment, or was it pretty much a straight climb for you? Everybody's different,
Just one very slightly.
but pretty much through the course of care, you continually progressed.
Yeah.
Right.
To the point where, people would see me that saw me during the last summer, and they were just amazed. They're like, what did you do? Even in fact, my family doctor, when I went back to him, he said, what happened to you? And I, explained the treatment to him. He was thoroughly impressed.
You were having numbness in your leg. Are you still experiencing that?
No, I haven't had that for the longest time.
I know that was one of the last things to go away,
That
though,
was
right?
the last thing, yeah. I just had a little numbness down the leg, and eventually even that went away. And now I would say, I have I don't even know, 99% better. I have to say 99 because it just, it's a little discomfort back there once in a while, but it's so minimal that I almost hate to even say it. I feel bad to even complain about it.
And recently you've talked to me about some exercise. I think you were doing rowing.
Yeah, back on the rowing machine, bike riding.
Excellent.
I lift within reason.
And your job entails a lot of sitting, so that's hard on your back.
Yeah. I try to make adjustment where I, get up and walk around and bother people during the day. That's an excuse to get up and not stay seated all day.
Excellent. Is there anything off the cuff that you'd like to share with other people about who would be possibly considering getting this care or might be suffering like you are?
I just don't see any reason not to do it. It was such a drastic difference, from what I was to what I am now. I can't speak about surgery from experience because I chose not to have it done, but I mean, if all else fails, that would still be an option in the end if somebody would choose to do that. I don't see why you would choose to do it, but I mean, this was a more natural approach. You have to be, you can't always look for like the quick fix because that may in the end not be the best thing for you. I'm sure it took time for my disc to get in the situation that it was, so it just seemed to be a more natural approach to take a little bit of time to get it back in condition.
Thank you very much.
Okay.
Hannah, I like to be called Winnie. I have been in severe pain for 17 years. I had back surgery in 1989, October 31st, 1989, and it didn't help. And then a few years after that, I re-injured myself by falling. And so therefore, I've been in serious pain. I had pain going down both of my legs. I've had burning sensations. My feet were constantly on fire. I've been to doctors, many doctors. I went to orthopedist. I went to pain management. I have been on lots of drugs. In fact, I became an RX pill popper. And I had to because I was in so much pain. And then I found out about the DRX 9000 machine. And from the day I started, May 31st of this year, 2006, I have been improving dramatically. I could not believe the very first session I was laying in the machine and I felt my toes for the very first time. Every week after that, I have been more and more improved. I am so thankful for finding this answer. For everyone who hears my voice out there, please know that there is help for you. It is the DRX 9000. I know it because I'm living it. Today is July the 9th, 2006, and I'm coming down to my last week of therapy, and I'm looking forward to the rest of my life now that I have no more pain. Thank you. Now I'd like to explain to you about the DRX 9000 machine. While you're in the machine, what is happening to you, number one, is incredible. You're laying there and the machine is starting to pull equally on your hips. It is taking your pain instantly away. I have found since treatment, every time I go into the machine, it's different. I'll say to my husband, I don't know what's happening, but something's happening to my body. I feel all kinds of weird things until later in the evening I'll be sitting in my chair watching TV and I'll say, oh my, I think I'm feeling more of my foot. Oh, yes I am. I got up one evening to walk across the floor and I felt the carpeting for the first time. I also felt my puppy for the first time, his little fuzzy hair. Everything that this machine does to you is to improve the quality of your life. Trust me. I am now a survivor of no pain, and it's only been a few weeks. Total 5. Thank you for listening to me. I'd like to also explain to you the things that I've been experiencing. I have my feet back, which I haven't had in 17 years. I can feel them. Plus, I'm walking now. And yesterday, Sunday, I was able to stand for a long period of time to be able to clip my poodle, which I haven't been able to do. I would start him and I'd have to sit down. Yesterday, I stood there the whole time and only said, I have to take a drink of water. That was my only pause. And I have to say, thank you, Dr. Lerman. Thank you.
Thank you. Dr. Lerman again, and I'm here with Winnie. And Winnie's going to share with us some of the things that she's experienced with the DRX 9000 treatment and the problems that she's been through and how she got here to see me. And let me first start with asking you, what was your main problem when you first started coming in?
I had severe spasms down both of my legs, burning down both of my legs. My feet were constantly on fire. I was in constant pain 100% of the time.
And how long have you been that way?
17 years.
And what were some of the things that you've done for it prior to coming to see me?
I went through orthopedist. I was on medications, Duragesic, pain patch. It started out at 25 milligrams, then I went all the way up to 75. That wasn't helping. Then I was sent to pain management. I had injections in my spine, and I became very, very allergic to one of the medications that was in the needle, and I almost died. And I started with more medication. It was a medication that constantly was being increased until I became an RX drug pusher. And after that, I went home and told my husband, I can't do this anymore. I can't be on this medicine. I'm just a walking, talking zombie. I was no good for myself, and I certainly wasn't any good for my family. And then from there, we went to Florida for our vacation. And during the time I was in Florida, I found out about the DPR 9000.
DRX.
That's right, DRX 9000. At the time, the doctor there said he would see me. I went in for a consultation, and unfortunately for me, we're getting ready to come home. But he said he felt the machine could help me. So my husband got on the internet, and that's how we found out about you. And that you were basically in our area because the doctor in Florida said to travel as long as I would have to travel back and forth to his office would have been too much for me. But this is a lot closer.
Now, you had a couple of surgeries, too.
I had back surgery in 1989. I had a herniated disc that was pressing on my sciatica. And I was in so much pain, and they told me I'd have to have surgery. And after surgery, it wasn't any help at all. I still had pain. But I had another fall on the kitchen floor, and that started all over again. And that's why I went back to my orthopedist.
So there was no relief after the first surgery?
No.
And the drugs didn't help?
No.
And then you fell and you had a flare-up and it got even worse?
Yes.
And prior to this, how was it? Were you able to walk much distances?
No, I couldn't walk. I couldn't walk even 25 to 30 feet without severe, severe pain. And now I'm walking and taking my puppy for a walk, which he's loving.
And how about driving? What was that like?
I couldn't drive. My husband had to drive me.
And how about, I know you guys take long rides in the car. And
That hurt terrible. We couldn't go for any longer than a 4-hour period, and I'd have to stop. Of course, a lot of stopping in between But that was the distance that I could travel, was 4 hours, and then we'd have to go off the road.
And you haven't had any long trips since your treatment?
No, but I'm looking forward to it as soon as you say I'm free.
You're just about there. You've done wonderfully.
Thank you, Doc.
Thank you. I'm so glad you're here.
Thank you. God bless.
God bless you.